Everyone. Now we are discussing about the pulmonary hypertension. Pulmonary hypertension means there is a increase in pressure in pulmonary artery and right ventricle. So it is basically caused because of most of the time because of lung diseases like COPD, chronic pulmonary obstructive diseases, or left-sided heart diseases, which ultimately causes some pulmonary hypertension. So what happens in this pulmonary hypertension? There is a congestion and increase in breathlessness during the mild to moderate exercise, and ultimately when right ventricle get failed, the signs of right ventricle like the leg swelling, anasarca, increase venous pressure in jugular venous. So all these causes even the decreased appetite, abdominal distension, ascites. These are the signs of right ventricle failure when pulmonary hypertension is too much higher than the right ventricle can accommodate. So how can we investigate and diagnose these cases? The first and foremost is a history. Depending on the history, we can point out the diagnosis like patient smoker, COPD, other lung diseases, tuberculosis likewise. Even for further investigation, we can do the ECG. ECG can suggest right ventricular strain pattern or right ventricular hypertrophy. Then the 2D echo, the cardiac sonography. In that, right ventricle shows the pressure gradient increases, and other pulmonary regurgitation or tricuspid regurgitation, which is indirect measurement of pulmonary artery pressures. So early diagnosis is best because it can reversible in early stages, but once it get advanced, the reversibility will decrease. So early diagnosis, early treatment is very important. So the treatment it depend on the different cases and the etiology also. If it is reversible, we can consider for the vasodilator specifically acting on the lung or pulmonary arteries like ambrisentan, bosentan, or sildenafils. And if symptomatic other treatment like diuretic, which increases the urinary frequency, so pedal edema and ascites will go off or get controlled. Other the mild to moderate exercise and occupational therapy, patient education, these are the important. So for most important is early diagnosis, early treatment. Thank you all.